name is Adrian. I am a student nurse. I'm here to do a head-to-toe assessment. It's going to take roughly 15 to 20 minutes. It's meant to establish a baseline for your health. Is that okay with you?
Yeah.
Excellent. Can I please verify your first and last name as well as your date of birth, please?
Millie Larson, 12/14/35.
Okay, and I'm going to verify that with your wristband on the chart. Okay, perfect. Okay, Millie, do you have do you prefer to be called by Millie?
Yeah.
Okay, Millie, do you have any allergies that I should be aware about?
I don't have any.
No allergies? Okay, do you know where you're at today?
Concordia Hospital.
Concordia Hospital? Okay, do you know why you're here?
No, my daughter just brought me here.
Okay, do you know what date it is?
Thursday.
Thursday, okay, do you know what month it is?
Yeah, it's August.
August. Okay, so the patient is alert-oriented times 3, disoriented to the situation. So Millie, your daughter says that you had some pain in your leg. Does that ring a bell?
Yeah.
Can you tell me where that pain is?
Yeah, it's kind of like aching on my left knee
Your
when
left
I
knee?
bend it.
Okay.
Yeah.
When did that start?
This morning when I fell.
This morning? Okay.
Yeah.
What does that pain feel like?
Pretty like achy and dull.
Achy and dull. So from a pain go from 0 being low pain to 10 being severe pain, can you please describe it, or rate the pain, please?
A 2.
A 2? What would your pain go like? Or what would you like your pain go to be?
A 0.
A 0? Okay. So definitely during the assessment, once I get down to the lower extremities, if you do feel some pain, let me know and then we can stop the assessment, okay? I also noticed that when you did come in, you said that you had shortness of breath, but you feel better when you're sitting upright. Is that true?
Yes.
Okay, we will definitely keep you in the upright position, and then when I have to get to your nasal cannula to take it off, be sure to put it back on as soon as possible, okay? Before we start the assessment, I'm going to just go over the vitals. I see that your temperature was 100 degrees Fahrenheit, so you have a little bit of a fever. Your blood pressure is 140/84. You have 95% oxygen saturation. I see that you are on 2 liters of oxygen, and I see that it is on. Is that a good flow rate for you?
Yes.
Okay, excellent. And I noticed that during you speaking that you have no slurred speech. So now I'm going to get ready to start the assessment, okay?
Okay.
Okay, so I'm going to begin with the top of the head, and I notice that your hair is evenly distributed, it is thick, no signs of baldness. I'm going to be checking the back of your neck, okay? I do not see any skin breakdown in the back of your neck. As I assess your face, I see that your face is symmetrical. And I'm gonna assess your temporal pulses. Okay, temporal pulses are equal and bilateral +2. Before I assess your eyes, are you wearing any contacts, or do you have any glasses?
I'm wearing contacts.
You're wearing contacts. Can you see me okay? Okay, excellent. So I'm gonna begin with your eyes, okay? What I need you to do is just pick a spot on the ceiling and just stare at it, okay? I'm gonna shine a light in your eyes. Okay. Excellent. And now I'm going to assess your 6 cardinal fields of gaze. So what I need you to do, I need you to stare at the tip of the pen and only move your eyes, okay? 1, 2, 3, 4, 5, 6. Okay, keep staring at that tip of the pen, okay? Okay, perfect. And now I'm going to assess your pupil size. Okay, pupil size are a 4, so your pupils are 4, and they are perla. They are equal, round, reacting, and accommodating to light. Okay, so now what I'm going to do is I'm going to assess your ears, but before I get there, are you wearing any hearing aids, or do you need any hearing aids? No? Okay. Is it okay if I remove your nasal cannula?
Yeah.
Okay. Sorry if I'm pulling your hair. And I know you're short of breath, so I'm going to be sure to put that back on as soon as possible, okay? As I assess your left ear, I see no excess cerumen, and I look at the back of your left ear, there's no signs of skin breakdown. If you could just turn your head a little bit. I'm going to look inside your right ear, no excess cerumen, and the back of your ear, there is no skin breakdown as well. And then just real quick, I'm going to look inside your nose, okay? Okay. There's no signs of polyps, and it is moist, and there's no skin breakdown. Okay, so I'm going to go ahead and put your nasal cannula back on. Okay, I don't want to pull your hair. Excellent. Okay, and so the next thing I'm going to do is I'm going to assess your mouth. So can you please open your mouth, please?
No masses or.
Okay, mouth mucous membranes are moist and tongue is pink. You don't have any dentures?
No.
Okay. Do you have any trouble swallowing? No. Do you think you can swallow for me, please? Okay, trachea is midline. Do you have a cough, Millie?
No.
No cough as well. Okay, perfect. Okay, now I am going to assess your carotid pulse one at a time.
Diet. Are you?
Okay.
Thank you.
So each carotid pulse is strong +2. Okay, now I am going to assess skin turgor. Okay, skin is brisk and no signs of dehydration. And so now, Millie, what I'm going to do is I'm going to assess your brachial pulses, okay? So I'm going to lift your count a little bit. Okay, brachial pulses are equal and bilateral and +2. I'm going to assess your radial pulses. Equal bilateral and +2. As I look at your skin on your arms, it is skin color appropriate to ethnicity. Your skin color is warm to the touch. Did you feel the sensation as I touched your arms, Millie? Okay, so sensory is intact in the upper extremities. No signs of edema. Right now, I'm going to assess the range of motion. Okay, so what I'm going to have you do is I'm going to have you put your arms out wide. Okay, and then I'm going to have you put them straight up and straight down, and then put your arms towards your face. Excellent. And then as I look at the bottom of your elbows, I see no skin breakdown, and then your range of motions are intact for your upper extremities. All right, Millie, I'm going to assess for your strength, okay? So what I need you to do is I need you to pull my hands, okay? Okay, can you push my hands? Okay, and then can you squeeze my fingers? Okay, strength is 4 out of 5 for your upper extremities. And now I have your hands here. I'm going to assess for capillary refill. They are less than 3 seconds. There's no numb and tingleness in your fingers, okay?
Okay, any trouble pain?
Okay, so that wraps it up there. What I am going to do now is I'm going to assess your heart, okay? There are 5 points that I need to listen to, and I'm going to listen to them in a Z formation. The 5th point is between the 4th and 5th intercostal left of the midclavicular line. When I do get there, it is underneath your breast. So do you feel comfortable moving it yourself, or would you like me to use my back of my hand when I get there?
I'll do it.
Okay. So Millie, before I start, I'm going to just pull down the blanket here, and I'm going to maintain your privacy, and I'm just going to lift the gun just a little bit. Okay.
Pull this up here. And I know you said you had a little bit of trouble with your leg. And then are you able to bend your wrist in and out through your mouth? Okay. Okay. Great. I'm just going to feel under here for popliteal pulse.
1,
Bilateral. And can you feel, no tingling or numbness? Okay. And I don't see any edema on the legs either.
3,
So
4, and then into the
and
spot.
limited like range of motion, are you able to lift your heel up a little?
Equal rise and fall.
Okay.
And there's no
Just gonna break down. Thank you so much. You any pain that kind of hurt a little, so what was your pain level? Okay. And what's the range? 1 out of 10. Okay. And what is your pain goal for? Okay. Great. We'll work on that. And do you mind if I take off your gloves? Okay. Let me know if you're cold. Okay, and I looked at the heels, we're all good. I'm going to be feeling for the posterior tibial pulse, strong equal bilateral, and the are clear, and there is dorsalis as well. Now I'm going to opposite attitudes and do dorsalis. Strong equal bilateral, and capillary refill on the toes, push against my thank you.
So S1, S2 word noted. Beats per minute, we're 77, and your respirations are 18, okay? So what I'm going to do now is I'm going to listen for your lung sounds. There's going to be 6 spots on the front and 8 on the back, okay? So what I'm going to do is when I place the stethoscope on for each spot, I need you to breathe in through your mouth and out through your mouth, okay? Deep breaths. Continue to maintain your privacy. Okay, go ahead. 1, 2, 3, 4, and 6. Okay, so lung sounds in the front are clear. There's no adventitious sounds. It was equal rise and fall and no signs of labor breathing. Okay. Now I'm gonna check for your posterior side for your lungs. If you can you please grab that bar and I'm gonna now assess you. Okay. Okay. Same thing, Millie. I need you to take a deep breath in and out. Okay. Go ahead. 1, 2, 3, 4, 5, 6, 7, and excellent. Same thing, there's no signs of adventitious lung sound. Lungs are clear. As I check the back, there's no sign of skin breakdown as well on the cough. Okay, Millie, go ahead and turn over. Okay, excellent. Now what I'm going to do is now I'm going to assess the abdomen, okay? So I'm going to need to pull your gown just a little bit up. Okay. As I check the abdomen, I see no signs of distension and it is symmetrical. What I'm going to do now is I'm going to listen to your abdomen, okay? I'm going to listen to it starting at the right lower quadrant. Okay, and now I am ascending. And now transverse. And now descending. Okay, so there are active bowel sounds in all 4 quadrants. What I'm going to do now is I'm going to palpate your abdomen, okay? Okay, there was no signs of masses or anything protruding or no signs of distension, okay? Before I palpate your bladder, do you need to use the restroom?
No.
Okay. Okay, same thing with the bladder, there's no signs of distension. And then I'm going to lightly palpate your femoral pulses, okay? Okay, femoral pulses are equal and bilateral and +2. Okay, Millie, when was the last time that you wet poop?
Last night.
Last night. Can you please describe it to me?
Soft and brown.
Soft and brown. Okay, do you have any trouble going to the restroom or poop?
Not usually.
Not usually? Do you have trouble getting to the bathroom?
No.
No? Okay, and about urine, I noticed that you have, your intake is about 1,800 and your output is around 1,200. How frequently would you say you go to go pee?
Like 4 times a day.
4 times a day? Okay, do you have any trouble getting to the restroom as well?
No.
Okay, is there an odor?
No.
And what's the color like?
Like a dark yellow and cloudy.
Yellow and cloudy. Okay, Millie. So what's your fluid intake like? How many bottles of water do you drink a day?
Like 3.
3? Okay, I definitely recommend we try and get your fluid intake to about 6 to 8 bottles of water a day. I think it will definitely help try and clear that color that you have with your urine. And then now talking about your diet, can you please tell me about your typical daily meal?
Smoothies in the morning.
Okay.
For lunch, I'm not really that hungry, so I eat some rice. And then for dinner, I like tacos.
Tacos. Okay, it definitely sounds like you do have a variety in your meal choices. There is something out there called My Plate. It could definitely help you for more nutritional choices. And definitely here at the hospital, we do want to keep up giving you, some proteins as well as vegetables. So I'll definitely offer that resource at the end of this head to toe assessment. Okay? Okay, excellent. What I'm going to do now is I'm going to assess the lower half. Okay? As I inspect the legs, I see no signs of edema. Skin is warm to the touch. There's no signs of, scratch that. I'm going to assess your popliteal pulses now, okay? So if you can you please raise your knees just a little bit? Okay, popliteal pulses are equal bilateral and +2. I'm going to assess now your tibial, posterior tibial pulses. They're equal and bilateral and +1. +2, and I'm going to assess your dorsalis pedis pulses, okay? These are equal and bilateral and +2. I'm going to assess your capillary refill now, okay? Capillary refill is less than 3 seconds. What I'm going to do is I'm going to assess for the bottom of the heels, okay? And I'm going to assess this side. No signs of skin breakdown. Okay, so I know that you did have some pain in your leg, okay? I'm gonna check your range of motion. Do you think you can try and lift your left knee to your chest?
I can do this.
Okay, can you do your right leg?
Yes.
Okay, so there's limited range of motion on your lower extremities. I'm gonna test your strength now, okay? So like a car, like gas pedal, do you think you can push my hands down? You're under 15. Okay, and then do you can pull them up? Okay, strength is 5 out of 5 on the lower extremities. Okay, so that pretty much wraps up down here. So now, do you have any walker or any assistive devices that you use at home?
I think my daughter brought my cane.
Okay,
somewhere.
so you have a cane. Okay, Millie. So what I'm going to need to do is I'm going to give you a call light. And what's that for is because I need to assess your gait as well as your posture. So next time that you need to use the restroom, please hit this call light button, and I'm going to come and check that for you, okay? If there's any other questions for me, please let me know. And that pretty much wraps up our head-to-toe assessment. And I'm going to hand hygiene out. And that wraps it up.
Thank you.